David already spoke this morning, but I had to actually put this slide in. Why is anti-doping important to Thermo Fisher Scientific? Well, we are in ourselves 70,000 people with kids and relatives, and this all matters. And I think whether you're talking about drug trafficking or the public impact for the athletes, social influence doping, right? This is going down into people just playing softball, right? And they think, well, this is okay. These folks did it, so I have access to it. Why can't I? And then, of course, I think the aspects of political corruption. So very, very important to everybody. So we look at what's going on, and I'm going to have to move very quickly here with only a few minutes, but I'm here, and I also want to quickly say that Alain Guillet is here. He's been working with he's our VP of Commercial, one of our VPs of Commercial Excellence, been working with a lot of the labs on workflow development. We'll be here until Thursday. We'll be here as well, so if you have any questions, please reach out to us. But we look at what's going on as the expansion of the performance-enhancing drugs, monoclonal antibodies, protein therapeutics are all coming, right? And we're looking at that. I look at them from a clinical aspect and measuring their impact and companion diagnostics, but we know they'll come to performance enhancement. Going from a few to a large number of samples, both David mentioned it this morning. We need to enable more testing, and I'll talk a little bit about how we view our part in that. And then, of course, the ease of use of the instrumentation. Part of the challenge of mass spectrometry, at least, is getting it into places where it can be used routinely, robustly, and you don't really need a PhD expert to run it. And we look at the work streams in the labs themselves as passport testing, prohibited compound screening, confirmation of trace drugs, doping control with retrospective analysis, and that needs to be done with a high-resolution accurate mass instrument because triple quads are targeted. And then steroid quantitation and qualitative analysis as one of those challenging work streams. Steroids have always been a challenge for mass spectrometry. They're a fairly neutral compound. But today we get to levels that are 10 to 100 to 1,000 times more sensitive than we did 20 years ago. So that's one aspect. So why use LCMS? Well, LCMS in particular, GCMS has been used for a long time. But LCMS has been expanding, displacing a lot of GCMS and other techniques. Of course, you need selectivity and specificity, and you do get that with the high-resolution accurate mass instruments. More information is required. We need to address some of the cater to the growing list of analytes. Sort of expect future requirements. That means large molecules and gene doping, another topic this morning, reducing the cost per sample, and making sure we get the right instrument for the job. We've deployed our technology, and our competitors' technology is also deployed in the labs, of course, as well. When we look at a typical quote-unquote water lab setup as GCMS, GC triple, maybe GC high resolution, LCMS high resolution, LCMS triple quads, isotopic mass spec, something that Thermo Fisher's been involved in a long time. I came to the company when it was called Finnegan, and so we've been doing it since those days, isotopic mass spec. And then, of course, an area where we haven't been involved as much, and that is in, I don't know if this works or not, no, in the sample prep. And I think, as we all know, to excuse the expression, it's crap in, crap out. So if we don't collect the sample properly, if we don't prep it properly, then we get a bad result. And of course, gene doping is an area where Thermo Fisher has also a wide variety of products that could be applied. And as well, the sample LIMS systems. And I think we had a great deployment in Rio as well when it comes to like tracking the sample from end to end. But in particular, I want to talk about some of these, what I'll call spot analysis techniques. And I only have a few more minutes, but I'm going to hit them real quick, and I hope this just drives conversation for later this week. We are pushing constantly the boundaries of speed and sensitivity. This is just a diagram the kind of work we're doing to try and get ions from the front all the way to the back. It continues, our competitors continue, we all push each other to make this happen. This lowers, increases sensitivity, lowers detection limits, of course, and we're also trying to push speed because everybody wants to get the samples through faster. But there's the other aspect of mass spectrometry is, in fact, resolution. This is courtesy of Alexander Makarov. I think most in the room here will know what resolution can get you in terms of separating compounds that have the same molecular unit mass. We are actually, we're at the level now where we have Orbitraps. And when I first put this slide out, this slide was a prospective slide when I first was talking to ICRAV, the animal doping group, that we could do 1 million resolution. And now it's a product. This is only 3 or 4 years later. It's a routine product that we sell. So we're improving sensitivity. We're vastly and dramatically improving selectivity as well. Again, just an example of a peptide. I was glad to see there was an award for peptide analysis today, where on a triple quad, you think you see 2 responses, but in fact, the big part of those bulks of those curves are not actually correct when you get down to 10 part per million with resolution. That's peptide in urine. So one of the discussions that will continually come up is, do I use a triple quad? Do I use HRAM? Triples, I think most of you are aware, they're more sensitive in general. They are quite fast. But with Orbitraps or high-resolution accurate mass instruments, you get the advantage of retrospective analysis. That's one of the biggest differences. And of course, solving maybe some selectivity issues. So what does this, why do these matter? Well, sure, we can generate improved quantitative precision in LODs. We can improve confidence in the identification. And we can also improve unknown and metabolite ID workflows. And I'll just mention real quickly, part of my role is also in really, I proposed an initiative at Thermo Fisher about 5 years ago, called Measure Everything, or Measure Anything. Between doing genomics analysis and proteomics analysis and metabolomics analysis and targeted quant, we're going to get to the point where hopefully it is an N of 1, and you will start monitoring the individual and what changes in the individual. And of course, doping would create a change, but what you eat creates a change. This is the other thing we're beginning to see. Whatever you intake creates a change, and we're getting to the level where we can see that. So it's going to create yet another challenge. But some of the things that these improvements give us are capillary flow rates for proteins, perhaps, instead of running the artful technique of nanospray. Lower sample volumes or the analysis of spots, and then access to using new introduction techniques where we needed more sensitivity or selectivity because we're not separating as much. And then so this is just a quick example of nanospray versus running at capillary flow rates. We can actually get more IDs because the instrumentations today is done in a faster time frame for global protein profiling. And we're looking at platforms where we do exosome profiling, protein profiling, to plasma proteomics profiling, to give our customers these platforms that simply work for identifying the compounds and quantifying the compounds. Briefly on dried blood spot analysis, this is the old way of doing things. We are enabling automation for dried blood spots with the Spark DBSA autosampler. We're working with a couple of labs on this that go from clinical to anti-doping. So we intend to make this a very straightforward, easy to operate system where you take a dried blood spot card and it clamps into the system and it gets run. And we have a sample prep built into that. Another technique that we've invested in recently is paper spray. Let's get rid of all those steps in the middle and really see if we can just take blood on a cartridge and actually just spray it out into the instrument. And what comes off of there usually best is exogenous drugs that we've optimized the solvents for. And it leaves the endogenous materials behind, although we'll be looking at endogenous uses of paper spray. So those two diagrams you just saw were the old version of paper spray. This is the new version of paper spray we just launched last week. On the left-hand side is an autosampler. Behind the big box, of course, is the mass spectrometer and the source with the solvents sitting in the middle there. That little cartridge down on the base is 24 sample strips of paper. You can load urine, blood on a robot and run those directly. We've already done applications for drugs of abuse, immunosuppressants, some therapeutic drugs, and antifungals on this. So you're going to see this product out in the marketplace soon, and we're working with a couple of water labs on this with this technology as well today. And we're not going to have time to go through this, but another technique we're looking at is solid phase microextraction. It's been around a long time. It's been used in GCMS. There's been some anti-doping applications for it. But in particular, we're interested in this blade. So if you think about paper spray spraying off of paper, we could also spray off of blades. But in this case, we have a solid phase solid phase extraction surface on it to extract the sample. So right out of a urine, just dip it in, put it in spray for screening. It will already be extracted, essentially. Very rapid analysis, primarily for screening. And also very quickly, trying to stay on time, which I'm almost there, is the MS pen. Some of you may have heard of this in the press. If you think about a piece of plastic that literally is disposable, it's about the size of a pen, hooked up directly to the mass spectrometer. This is an Orbitrap actually in the operating room where they're doing tissue analysis. And you simply touch it to the tissue. It takes about 10 microliters, and it's equivalent to what is a DESI type of analysis and goes back to the mass spectrometer and can screen for this. So the initial IRBs for this are around cancer, but clearly I think there's applications in anti-doping potentially that you could just touch somebody's skin and at least pick up high-level drugs of abuse. There'll be limits on sensitivity for this, but we're also looking at this technology. And I just lastly want to say, we're working on these kinds of devices where we're going to take mass spectrometry, and this is launched in Europe for vitamin D. This is a Mass Spec clinical analyzer. It has a LC and a Mass Spec inside, but really you put a blood tube in it, you get a vitamin D result out the back. You push the button, that's it. It's random access. So this is where we're trying to take mass spectrometry these days. This device will continue to expand its menu for clinical, but the concept, of course, could be applied to many other industries. And finally, there's a lot of, I was at the meeting 2 years ago, and there's a lot of discussion about miniaturized mass spec. And when you miniaturize mass spec, there are trade-offs. There's a lot of discussion of why haven't manufacturers made mass specs, handheld Star Trek devices? Well, it's because there's trade-off. It's just not that easy. And there's a lot to it, and we're working on this. So here what you have is a diagram on an idea that we will have at some point a point of competition analyzer is possible. All right, POC, usually people think of clinical for in the lab or in the hospital doctor's office. But POC here is an idea where we could use paper spray or miniaturized LC with finger stick sampling, even right at the device, and have something like a robust ion trap in a portable device that could actually be at the point of competition for analysis. So we are investing, and I've been investing for the last 5 or 6 years on these different sampling devices. I saw the sense abuse device earlier, the breath device. I've been helping them for 5 or 6 years as well, try and socialize their device. And clearly we see the use of it towards anti-doping. But we want to get to the spot where this, is actually feasible and doable. I had some discussions with MLB and NFL in the last meeting about something like this and what they might use it for. So finally, with that, I will be here the rest of the week, and Alon's here, and we have our booth outside as well for discussion. I just want to thank everybody on the Thermo Fisher teams and our collaborators, and love to work with everybody here at PCC in driving this technology and really changing how anti-doping is approached. And my last comment is that discussion today about should we get rid of water labs. I think water labs and what we do today is a big deterrent. So I don't think we can take that away anytime soon. We need to continue that. And again, I look forward to any questions you might have. We'll be around for a couple of days. Thank you.